afternoon. I'm Rejwanul Islam. I'm a technical coordinator at UNDP Bangladesh. I'm speaking for Dr. Abul Kalam Azad of the Ministry of Health in Bangladesh, who unfortunately couldn't come, as many of our team members couldn't come due to visa issues and other problems. So now I would like to introduce to you the mobile phone health service, which is being developed by the MI's Department of the Ministry of Health and Family Welfare of the Government of Bangladesh. Now, our motto is it's a doctor for citizens, anytime, anywhere. That means a lot of our population live in the rural areas, and they are poor. Actually, in Bangladesh, in the private sector, there are some initiatives of giving mobile-based doctor advices. There are certain things like you have to pay like Indian rupee of 25 Indian rupee to get advice from a doctor. This service is there, but this is not applicable to the poor because they can't pay or they don't have that much access. And those services are based in Dhaka only. So, okay, now this is called M Health, which is based. Okay. Can anyone help me? Yeah. Thank you. Okay, so we are actually using the existing infrastructure here. Actually, in each district we have hospitals, and each upazila we have several hospitals. So what we have done is that we have given mobile phones there, one mobile phone in each area, in each hospital. And next, please. And so this is actually the framework of how our existing health network. There are from the national level to the divisional level to the 64 districts and 483 upazilas, and there are different kind of hospitals. And each hospital we have given one mobile phone, and the idea is to harness the existing manpower, because in Bangladesh there is a shortage of doctors, and especially in the rural areas, because those doctors who are especially working in government institutions, they like to be in the urban areas. They don't want to go to rural areas. So there is a shortage, there is a need. But there are some, at least there are one or two in every hospital, available. So the idea is to harness the existing manpower, and what we have done is to give the mobile to the duty doctor. So one person is present there. There is no dedicated person who may go on a leave or something like that. It can be anybody. So they can take the call and capture the clients or the rural poor. Next, please. Yeah. So now we can offer the service 24 hour, and all over the every day in the week. There is no holiday for this service. Next, please. Yes. So what now we are not actually publicizing this at this instant. There is no national level communication, but what we are doing is that we are trying to send a message to the communities, local communities, through these mosques, temple, pagoda, and school, college, and the local government institutions. We're telling them that this service is available, and the website is up. And the hospital itself, they also, when the patients come, and they also tell them that this service is available, and they get the mobile number on which they can call, to which they can call. And they have done in a limited way, they have done some newspaper ads. And actually now there are almost like every day there are from 30 calls to 200 calls to each center, which the one person can cater. And we are also looking at the options when there will be more calls. So whether there will be a need to have more mobile phones and more manpower, and it will all depend on the growth of the popularity of this service. Next, please. And the benefit of this service is that it has a wider coverage, unlike the existing private sector options. It has wider coverage. I mean, the doctor is based in rural areas. He or she can speak their language and they knows of the particular problems of the area, and it can so they can reach to anybody everywhere. So it's simple to use, and the essence of this service is it is free. I mean, only the person has to pay for the call charge, and the service is free, and it is a better option to, there are, what people do is that when they have no option, they go to unqualified healers, and those are actually, those create more problems rather than solving the problem. And actually, what happens is that in some cases, there are urgent need. I mean, the health clinics are far away, like 5 or 10 kilometers. So a phone call can save the time of, going there and having the solution. For immediate and small problems, it can be very, very beneficial. Next, please. Yeah. So actually, a study shows that the women prefer to talk to a healthcare provider over phone, because sometimes they are not willing to go to an unknown person and talk about, their personal problems, or health-related problems. And so the mobile phone health service is becoming popular, and people are, from words of mouth, people are knowing about it, and they are increasingly using it. So, and so the government is planning to expand this service to more and more community clinics. So we have planned for covering 18,000 clinics, which the network we have, but so far we have gone, reached 10,000 clinics. Yeah, next please. Okay, so we're skipping this demo because, okay. So I'll just add something to that. Actually, what is our next immediate plan is that this is not all. Actually, the ICT part comes after this. This is only the mobile-based solution. Now we're also developing an ICT-based solution where there will be a database and and there will be telemedicine service through that database. People will first register there, and we'll have a database of all these. They'll register their mobile phone numbers, so that we can send SMS. Of government services, for example, immunization dates of or blood collection dates, and they can send, the information can be sent to the people. And we're planning a well-connected health system where, internet, video conferencing, and these services can be used to reach the more, these are the consultants who may live in the urban areas, who are not accessible in the rural area. But for example, a rural patient needs that help. So this kind of setup can solve the problem. And also, they're also providing a digital training facility where all these, because more and more ICT infrastructure will be rolled out to these clinics, and these people will be trained. And there is also a disease pattern mapping using GIS So these are also all planned, and these will be rolled out in the coming years. So uh, thank you for listening to the presentation.
I'm Deepak.